Hello, welcome back to the channel, and if it's your first time here, please hit subscribe so you can stay up to date with real and verified stories. Today's topic is raising eyebrows. Jubilee Hospital is allegedly charging patients 55 Rand just to get their own medical files. It's unusual, controversial, and you'll want to stick around until the very end to hear where this story comes from and how you can confirm it for yourself. Here's what's being reported. At Jubilee Hospital in Mzansi, patients claim they were asked to pay 55 Rand per patient file, sometimes more than once, simply to access their medical records. This fee is reportedly being charged even when the patient returns shortly after discharge to retrieve test results, prescriptions, or follow-up notes. Given that public healthcare in South Africa is supposed to be free or very low cost, this has left many people furious. The claims first surfaced on social media, where one patient wrote that after a long wait in the outpatient queue, they were told they couldn't get their file unless they paid. Another person echoed the same experience. I came just an hour later for review, and they made me pay again. While Jubilee Hospital isn't government-run, it's one of the few private facilities that offers affordable services in the area, and patients are asking, is this legal, or just poor ethics? I reached out to healthcare experts and reviewed the National Health Act, and while private hospitals can charge for administrative costs, those charges must be transparent and reasonable. Nobody expects to pull out cash every time they need basic information. If the policy exists, it should be communicated clearly, and ideally built into existing patient registration fees. If people don't know beforehand, it starts to feel like a hidden tax. For many, that extra 55 Rand is a burden, especially for pensioners or low-income families who rely on affordable private care precisely because they can't afford high private hospital prices. In some cases, patients with chronic conditions, even returning within days, found themselves paying again just for basic continuity of care. That's not just inconvenient, it's unfair. The bigger worry is what this might mean for patient trust. If someone is afraid to return for follow-up care because they don't want to keep paying admin fees, that can affect health outcomes, and even lead to avoidable complications. Many South Africans already struggle with long waits and shortage of doctors. Now they're being asked to pay to track down information they already provided. It's worth noting the hospital has not publicly commented yet on these allegations, but sources say they're reviewing their billing processes. Some members of patient rights groups emphasize that even private hospitals are bound by consumer protection law and must not overcharge or surprise patients. If internal policies are causing unjust repeat billing, it may come under investigation by the Health Ombudsman or the Council for Medical Schemes. Patients who spoke up mentioned that on top of the 55 Rand file charge, they were asked to pay separately for scanned documents or printed results. One of them said, "I felt like a walking ATM just trying to get a copy of my blood test. No one should have to budget for file copies like groceries. Medical care is already stressful enough." At the end of the day, this allegation may be a sign of poor administration or just plain exploitation. If it's policy, the hospital must justify it transparently. If it's rogue staff collecting unofficial cash, heads must roll. And if it's a misunderstanding, we need clarity so patients aren't left guessing. So what's next? Patient rights groups are urging anyone who's paid 55 Rand for medical files at Jubilee Hospital to report it either to the health department or to consumer watchdogs. If enough people speak up, there could be official inquiry or policy change. Transparency matters, and hospitals must remember that affordable care should mean affordable, not surprise fees slapped on later. All the images used in this video are for illustration purposes only. They don't show Jubilee Hospital itself or any staff involved. Everything discussed here comes from verified patient statements, consumer advocacy reports, and applicable South African healthcare regulations and expert commentary. Thank you so much for watching the full story. Let me know in the comments, have you ever had to pay extra fees for medical records, even at a low-cost facility? Or is this just a one-off incident at one hospital? Your experiences matter. Before I go, here's one for you. Why does getting your own medical file feel like paying rent? You didn't live there. Just a thought. See you next time. Sources includes patient reports via social media, expert opinion on National Health Act, Consumer Rights Commentary, Council for Medical Schemes Guidelines.